Hi, in this section we're going to move on to Chapter 2 about the demand for healthcare. So when we talk about healthcare demand, it basically just means the quantity of healthcare that people are going to purchase and consume. The idea is that demand curves are downward sloping, which basically means that when the price of something increases, people are willing to buy fewer. So if you're trying to sell, the example here is lollipops, and you sell them for $4, you'll sell fewer lollipops than if you were selling them for $1 or for 50 cents. Because as something gets cheaper, people are willing to buy more of it. So you can see in this graph that as the price goes down, price is on the y-axis labeled with the P. As the price goes down, the quantity demanded increases. Elasticity is a way of measuring how downward sloping demand might be. So in this graph here, the line labeled elastic demand, D sub E, is an example where quantity demanded is sensitive to changes in prices. So as you move up and down on the y-axis with price changes, the quantity demanded on the elastic curve is also changing. Inelastic demand, shown here is just the vertical up and down line, D sub I, inelastic demand. No matter what price is along that curve, the quantity, Q sub I, is exactly the same. So that would be an example of completely inelastic demand. It doesn't matter what the price is, they're still going to buy the same amount. So the question is healthcare one of those kinds of goods, like normal goods, when the price goes down, people buy more of them? Is healthcare one of those kinds of goods with a downward sloping demand curve? So, are people sensitive to the price change in healthcare? For example, is the demand for vaccines such that if the price is $100, people are going to demand a quantity of 1,000? Or if the price is $1, people are still going to demand a quantity of 1,000. So in that example, the quantity demanded is not elastic. It's just the same at every price. Or for another example, perhaps the demand for Band-Aids is such that with a price of 100, the quantity demanded is only 1. But perhaps at a price of $1, the quantity demanded would increase to 30. So the demand would be elastic in that example, where it varies greatly with price. One way for myself that I think about which one is which, elastic, if you think about like a rubber band, when the price changes, people are bouncing all over the place, changing the quantity that they are demanding. When it's inelastic, it's stiff, it stays the same. Change the price, nothing happens to quantity, just stays. The idea is, though, that if people kind of buy whatever healthcare that their doctors tell them to, and there are no other real considerations involved, healthcare demand should be inelastic. And it's also kind of hard to know for sure just from using observational data, because people oftentimes go with whatever their insurance covers, and so people who need more health care might end up signing up for the more comprehensive kind of health insurance, which also reduces the price of care once you have it. Usually, if you have like really comprehensive insurance, you don't have to pay out of pocket to consume most kinds of health care. So that looks like people perhaps are responding to that lower price of seeing the doctor with an increased quantity demanded of seeing the doctor or of filling prescriptions. But perhaps those were not people who were responding to the lower price of being insured, but instead people who were already sicker and for that reason signed up for the better coverage. So the question is whether the demand response is to the price reduction with insurance or if they're just responding to their own illness. And it's hard to tell when you're just taking observational data. So there have been some randomized experiments to get at the causality in that relationship. So a randomized experiment is a study that randomly assigns a treatment of some kind to different groups of study participants. So there's a control group that does not get a treatment, there can be a placebo group and a group that does receive a treatment. It helps to generate comparisons across these groups that are statistically similar to each other. Because if you're randomly assigning these different groups, you know that they're not in that group because they're sicker or because they want more insurance, but instead just because you randomly assigned them. So we'll look at a couple of randomized experiments in health insurance coverage in the next video.